Look, nurses comprise the biggest portion of the health workforce. They are the people who are there 24 hours a day, 7 days a week, looking after our friends, our family, and indeed ourselves. And we've just got to make sure that nurses, midwives and care workers are supported as much as they can to achieve that outcome.
What will be different is that this is nurse-led research, and it is research which will enhance nursing care, the care given by nurses and midwives to their patients.
The care that midwives and nurses give is so important, and then if they can, have as much research that they need to care for women and babies, then that's definitely important.
I'd always felt that pregnancy and birth and becoming a mother was such an incredible time in a woman's life. I just wanted to be part of that. Knowing that you've actually made a difference for that person's mothering or their health, I think is, pretty special.
Nurses make such a difference in people's lives, but we really need our own hard data, not only now, but over the next few years, because things change, and so the evidence needs to be contemporary.
It's hard because sometimes the evidence isn't there, not because it doesn't work, but because the study hasn't been done yet. So for example, something works, but perhaps there's not that study there to give us the evidence for that. So once you have the evidence, that's what changes practice within the hospital.
Last century was the century of development of technology in healthcare, which was extraordinary, and we are all the beneficiaries of that development. But there's a potential for the individual, the patient, to be kind of lost in the technological wires, shall we say. So that's where I see nursing in the future, this century, in providing that human touch.
This is about making sure that they can continue to make a difference, not just now, not just today or tomorrow, but far into the future, and making sure that everyone can get the best care possible.